I specialize in the care of adults with intellectual and developmental disabilities, and I've been doing this for over 20 years. And because of my history in the field of developmental disabilities, it's quite apparent to me, working in the United States, as I'm an American, so working in the United States, is that historically speaking, the care of people, children, adolescents, adults with intellectual and developmental disabilities, historically in the United States has kind of changed in terms of where we are at now, in terms of the level of care and where people live, is back in the 50 years ago, more than 50 years ago, people with intellectual developmental disabilities in the United States were basically majorly institutionalized. It was actually part of the American culture that people born with a level of developmental disabilities were devalued as people. And for the most part, when they were born, the doctors who were giving birth, helping to give birth to these babies and children, and the pediatrician that often would see them in the next ensuing days, weeks, and months of their lives, recognizing that person has severe developmental disabilities. Culturally, they were deemed, the person with developmental disabilities was determined to be a burden. And they're a burden not only to the family, but also to society. And society had created institutionalized care. And so in the fact that I've done this for 25 years, and in the fact that in the last 20 some years that I've been practicing, I've seen that myself in terms of the historical nature of the care practices within the United States where people live. In the United States, we still have a number of state-run institutions where people are basically had been young children at some point, and now they might be much older adults, including geriatric people, and they've been living in the institutions their whole lives. So they've lived in the institutions. And so my work in the institutions is seeing them as individuals that have been living in the institution forever, and realizing that our cultural mores in the United States have evolved for more socialized care, living with families, community supports, early intervention, having a greater value for them. And so I've personally have gone into that with my own recognition and knowledge of that. But I as a citizen of the country and who cares about developmental disabilities, I know that the people with developmental disabilities outside the United States and other countries, it's not quite like the United States. The care of people outside the United States with developmental disabilities, whether or not it's Asia or Europe or Eastern Europe or Africa, or, I can name lots and lots of other countries, how they are and how they're treated is very different. And I definitely had recognized that people in the former Eastern Bloc or Soviet Bloc countries actually had a different way in which they were cared for developmental disabilities, and that they were still living within the state institution system within Ukraine and other similar countries. I was invited to go to Ukraine by this organization. That's my whole background. A long-winded story about why. You have to kind of know the history to know where you're going. So to me, they're all connected. So I had was invited by this organization called Disability Rights International. Their executive director is Eric Rosenthal, and he created the organization back in 1993. And it was created by and large for the concerns that there were these institutions around the world, and that people living in institutions were greatly devalued, neglected, abused, and not getting the kind of care that they should get theoretically by a parent or mother or father or society in this community. And so they built a cadre of visits to many countries around the world to basically be a watchdog for them, to go in there, shine a bright light, big megaphone, and almost at the top of a rooftop yell out, "This is wrong, this is bad, this is not right, things got to change," and basically try to enlist as many people to listen to that story, governments, the UN, UNICEF, governmental leaders, people that are trying to support or not these various countries, to say that, for reform to take place, you got to close the institutions and make regulations, laws, and what have you. So DRI, Disability Rights International, for a lot of years has been going on these missions. You can call them a mission, where they're invited in basically by the country to some degree into the institution. They don't just knock on the door unsolicited. They're actually invited there. Often the people people that go on these missions is the DRI crew with advocates already in the country. So I was asked to be the medical eyes and ears for this latest mission in this past June, just a month before. So I left the United States on June 3rd and came back on the 12th. And I was there as the medical ears and eyes, me, Eric Rosenthal, and 2 Ukrainian operatives. And we did it with the BBC. We were alongside the British Broadcasting Company, who had a few months before also was with Eric Rosenthal and DRI in Ukraine. And they wanted to go back this time to expand, explore further, look at the current situation and kind of expand what they already saw and did and push upon it. And the war, you probably heard there's a war, right? I'm being facetious. There's a war going on. And so the issues and aspects of how does the war create a dialogue on what should be done, what can be done, why should we do it now, why should we wait, all these kind of questions were asked, including even myself deciding to go even now. So these are a question that I, too, had to get wrapped in my mind to make a decision on whether or not I personally felt safe or important for me to do it now. So that was beginning to give the semblance of me eventually signing on to go into Ukraine with DRI.